Title: Does TRT actually work? What the largest clinical trial found: a landmark clinical trial tested testosterone replacement therapy on over 5,000 men. And the results surprised even the doctors running the study. If you've ever wondered whether TRT actually lives up to the hype, or if it's just an expensive placebo, stay right here because the answer is more nuanced than anyone is telling you. Welcome back. If you're new here, this channel is dedicated to breaking down real clinical science so you can make smarter decisions about your health. My name is Host Name, and today we're diving deep into the TRAVERSE trial, the largest randomized controlled trial ever conducted on testosterone replacement therapy in men. By the end of this video, you're going to understand 5 things. First, what low testosterone actually feels like and who it affects. Second, what the science says about how TRT works inside your body. Third, what the TRAVERSE trial actually found: the good, the bad, and the surprising. Fourth, what practical steps you can take right now based on the evidence. And fifth, one finding from the trial that almost nobody is talking about. This is going to be worth your next 10 minutes. Let's get into it. Let's start with the problem, because chances are this is why you clicked on this video in the first place. Low testosterone, clinically called hypogonadism, affects an estimated 10 to 40% of adult men, depending on how it's measured and which age group you look at. But here's the thing. Most men who are dealing with it have no idea that's what's going on. Instead, they just feel off. Maybe you've noticed that your energy has been declining for years, not dramatically all at once, but slowly and steadily. You wake up tired even after a full night of sleep. You've been going to the gym but seeing less results than you used to. Your mood is flatter. Your drive, both in the bedroom and in your daily life, has taken a hit. And maybe you've even talked to a doctor who told you everything looks fine on paper. This is the frustrating reality for millions of men. The symptoms of low testosterone are often dismissed as just aging, stress, or lifestyle factors. And while those things absolutely play a role, dismissing the hormonal component means millions of men are living below their potential for years without ever getting an honest conversation about what might actually help them. The TRAVERSE trial was designed specifically to answer whether testosterone therapy is a safe and effective solution for men experiencing exactly these kinds of symptoms. So let's talk about what testosterone actually does in the male body, because understanding the mechanism helps you understand the trial results. Testosterone is produced primarily in the testes, regulated by a feedback loop involving the hypothalamus and the pituitary gland. It peaks in your late teens to mid-20s and then naturally declines at roughly 1 to 2% per year after age 30. By 60, many men have testosterone levels 30 to 40% lower than they did at their peak. Testosterone influences a remarkable number of systems. It plays a key role in muscle protein synthesis, which is why lower levels make it harder to build or maintain muscle mass. It affects red blood cell production, bone density, mood regulation through interactions with neurotransmitters like dopamine and serotonin. And yes, it is the primary driver of libido and sexual function in men. When doctors consider TRT, they're essentially trying to restore testosterone levels to what's considered a normal physiological range, typically between 300 and 1,000 nanograms per deciliter, using gels, injections, or patches. The goal isn't to push levels above normal. It's to restore what time and biology have taken away. What researchers didn't know for a long time was whether doing that was actually safe for the heart. That question led directly to the TRAVERSE trial. The TRAVERSE trial, which stands for Testosterone Replacement Therapy for Assessment of Long-Term Vascular Events and Efficacy Response in Hypogonadal Men, was published in 2023 in the New England Journal of Medicine. It followed 5,246 men between ages 45 and 80 who had low testosterone and either existing cardiovascular disease or high cardiovascular risk. Half received a daily testosterone gel, half received a placebo gel. The trial ran for about 3 years on average. Here is what they found on the cardiovascular question. TRT did not increase the risk of major adverse cardiovascular events compared to placebo. That was the headline finding. and it was genuinely reassuring for men and doctors who had been worried about heart safety based on some earlier, smaller, and more controversial studies. But there were some important nuances. Men receiving testosterone had a higher rate of atrial fibrillation, an irregular heartbeat, acute kidney injury, and pulmonary embolism, which is a blood clot in the lungs. These weren't enormous differences, but they were statistically significant enough that the researchers flagged them clearly. On the benefit side, men on TRT reported significant improvements in sexual desire, erectile function, and overall sexual satisfaction compared to the placebo group. There were also modest improvements in mood and energy. Bone density improved, but effects on physical function and cognitive outcomes were less dramatic than many had hoped. So the picture is real benefits, real risks, and a strong need for individual medical evaluation. Before we get to the actionable steps, a quick word. If you're trying to support your hormonal health naturally while you're doing your research or working with a doctor, there are evidence-backed supplements worth knowing about. Vitamin D, zinc, and magnesium have all been shown in studies to support healthy testosterone levels, especially in men who are deficient. I'll link some highly rated options in the description below. Always check with your doctor before starting anything new. So based on all of this, what should you actually do? Here are 4 practical steps grounded in the evidence. Step 1. Get your levels tested properly. A single testosterone reading isn't enough. Testosterone fluctuates throughout the day, peaking in the morning. Doctors typically want 2 morning readings below 300 nanograms per deciliter, alongside documented symptoms before considering a diagnosis of hypogonadism. Step 2. Address the modifiable factors first. Sleep deprivation, obesity, chronic stress, excessive alcohol, and sedentary behavior are all clinically proven to suppress testosterone. Before pursuing TRT, optimizing these factors can meaningfully raise your levels, sometimes enough to resolve symptoms entirely. Step 3. Have an honest conversation with an endocrinologist or urologist, not just a general practitioner. Specialists are better equipped to interpret your full hormonal panel, including LH, FSH, and SHBG, and to determine whether your situation warrants medical intervention. Step 4. If TRT is recommended, understand the monitoring plan. The Traverse trial found real risks that need ongoing attention. Blood pressure, hematocrit, and cardiovascular symptoms should be monitored regularly if you're on therapy. An informed patient gets better outcomes. Now here is the finding from the Traverse trial that almost nobody is talking about, and it genuinely surprised the research team. The trial found a statistically significant reduction in the incidence of type 2 diabetes in the testosterone group compared to placebo. Men receiving TRT were less likely to develop new-onset type 2 diabetes over the course of the study. This built on earlier smaller studies, suggesting that testosterone plays a meaningful role in insulin sensitivity and glucose metabolism. This is significant because type 2 diabetes is one of the most prevalent and consequential chronic diseases globally, and the connection between testosterone levels and metabolic health is something the medical community has underappreciated for years. It also raises an interesting question that researchers are now beginning to investigate more formally. Could optimizing testosterone levels in carefully selected men be part of a broader metabolic health strategy, not just a sexual health or quality of life intervention? We're not there yet in terms of clinical guidelines, but this finding shifts the conversation. It suggests that the hormonal and metabolic systems are more deeply intertwined than the traditional siloed view of medicine has acknowledged. Watch this space, because the research here is moving fast. Let's bring it all together. The Traverse trial gave us the most rigorous evidence to date on testosterone replacement therapy. It found that TRT does not meaningfully increase the risk of major cardiovascular events, which was the big safety question. It confirmed real benefits for sexual health, mood, bone density, and potentially metabolic function. And it identified real risks, including atrial fibrillation and blood clots, that deserve serious consideration and ongoing monitoring. The bottom line is this: TRT is not a fountain of youth, but for men who genuinely have low testosterone and who are appropriate candidates after proper evaluation, it can be a legitimate and meaningful medical intervention. If this video helped you think more clearly about this topic, Please hit the like button and subscribe. It genuinely helps this channel grow and keeps this kind of content coming. Next week, we're covering a topic closely related to today's discussion: why your sleep quality might be the single most underrated factor affecting your testosterone levels. You won't want to miss it. See you then.